Dear student, today we are going to start a discussion on next part of our continuing chapter, that is antibiotic. So today is our lecture number 4, in which we are going to start a discussion on aminoglycosides, type of antibiotics and tetracycline. So what are the examples of the antibiotics which we are going to cover under the class, that is aminoglycosides? They are streptomycin, neomycin and kanamycin. Now followed by, also we are going to discuss the next category of antibiotic, that is tetracycline. They are tetracyclines, oxytetracycline, minocycline and doxycycline. So here we are, myself Dr. Ketaki Dhane, here with going to explain you everything about the antibiotics, that is aminoglycosides and tetracycline. Now first of all, what are the aminoglycoside? The name itself gives us an idea about the structural and chemical composition of the compound, that is antibiotic. Now amino belongs to this particular class, contain the presence of amino functional group which is attached to the glycosidic ring. Now this is a class of the antibiotic containing, in which we are going to discuss about the aminoglycosides containing amino and glycosidic functional group. Now what is the definition of this particular class, that is aminoglycosides? Aminoglycosides are the group of natural and semi-synthetic antibiotic. Now this particular class contains the presence of natural derived antibiotic, as well as some of the antibiotics are semi-synthetic in nature. They are going to have the polybasic amino groups which are linked glycosidically. So they contain the presence of glycosidic bonds. There is attachment of the amino group to the glycosidic bond with 2 or more amino sugar. That means they contain the presence of amino groups. Some antibiotics are of natural origin, some are of semi-synthetic origin, containing a polybasic amino groups. That means they contain the presence of basic amino groups linked glycosidically with 1 or more amino sugar. So presence of amino sugar, presence of polybasic amino groups, and both of them attached with each other through a glycosidic linkage. So this is a particular definition of the aminoglycoside type of antibiotics. So once again we will revise. What is the aminoglycoside type of antibiotics? They are simply derived through natural or semi-synthetic origin, containing polybasic amino groups which is through glycosidic linkage attached with 2 or more amino sugars. Now aminoglycosides antibiotics are used particularly to treat the bacterial infections which are caused by the basically gram-negative bacteria. So this is particularly, we can say, a narrow spectrum type of antibiotics, because this is selectively used towards the gram-negative type of bacteria. Aminoglycosides can be combined, so that no doubt this is going to have the narrow spectrum of antibiotic, but we can combine this with the either class or penicillin or cephalosporin. So we can give the aminoglycosides in combination with the penicillin or cephalosporin to show the prolonged attack on the gram-negative bacterial infections. We can give this aminoglycoside type of antibiotics is in combination with either penicillin or with the cephalosporin type of antibiotic. Now what are the classes of these two antibiotics? Penicillin and cephalosporin are of totally different class. They are particularly beta-lactam type of antibiotics, and involved in the they are going to involve in the, or they are interfering in the procedure of formation of cell wall. So this is the mechanism of action of penicillin and cephalosporin. When we are going to talk about the antibiotic, that is penicillin and cephalosporin. Now, in combination with penicillin and cephalosporin, aminoglycosides show the particular action or stop the prolonged action towards the gram-negative bacterial infection. Though they shows antibiotic action by inhibiting the protein synthesis in the bacterial cell. So this is totally different type of mechanism of action while we are comparing the aminoglycoside type of antibiotic with either penicillin or cephalosporin. That is, aminoglycoside type of antibiotic inhibit the formation of the bacterial protein synthesis. These type of drug will break down in the stomach while going to show the antibiotic action. So, while if we are going to give this drug particularly through oral route, it shows they are going to be breakdown in the stomach, so they don't show a maximum therapeutic effect while we are going to give this particular drug with the oral route. That's why in order to avoid this breakdown in the stomach, aminoglycoside type of antibiotics will show the better activity when they are given through the parenteral route. Now, examples of the aminoglycoside type of antibiotics are streptomycin, amikacin, neomycin, kanamycin, gentamicin and netilmycin. So these are some of the examples of the aminoglycoside type of antibiotics. These drugs are used particularly for the treatment of gram-negative type of infections. So this is a particular structure of first example of the aminoglycoside antibiotic, that is streptomycin, containing streptidine as an inositol with two gonidino groups in their structure. So these are the two gonidino subchains which is attached to the streptidino, containing a streptose, that is pentose sugar, which is attached to the amino group, that is streptomycin. So this is an amino sugar attached to the streptose ring. So this is a particular basic structure of the streptomycin aminoglycoside type of antibiotic. This is a first line drug in the treatment of tuberculosis. This particular drug is having its ideal identity as it is used for the treatment of the tuberculosis, to treat the plague and brucellosis infections which are caused by the brucellosis is an infection caused by the unpasteurized milk, or if a person is going to eat half cooked milk. So this type of bacterial infection is caused when we are going to eat the unpasteurized milk and half cooked milk. Now, streptomycin, in order to treat the plague and brucellosis, it is given in combination with a drug, that is tetracycline. This is also used to treat the enterococcal and streptococcal infections. Next example of our aminoglycoside type of antibiotic is neomycin. So what is neomycin? Neomycin is used to treat the variety of skin and mucous membrane infections. To treat the gram-negative bacilli infections, as well as this particular drug is used to treat the gram-positive cocci infections. No doubt, the aminoglycoside type of antibiotics are particularly used to treat the gram-negative type of bacteria, but through some structural changes, the neomycin is drug used to treat the gram-positive cocci infections as well, and this is available in the form of cream in the market. So this the neomycin is going to have the presence of a number of amino sugar groups in its structure. Next structure is kanamycin. Already, while we are discussing the definition of aminoglycoside type of antibiotic, we have already discussed they do have the presence of number of amino sugar group in its structure and attached through a glycosidic linkage. So here is the presence of amino sugars. They are attached through each other through O-glycosidic linkage. So kanamycin is a narrow spectrum antibiotic. While we are discussing the classification of the antibiotic, we have classified them on the basis of spectrum of activity, on the basis of mechanism of action. On the basis of mechanism of action, we have divided them into two categories. If they are interfering in the process of formation of cell wall, if they are interfering in the process of formation of the protein synthesis. So they are divided likewise. So here is the drug, that is kanamycin, third example of aminoglycoside type of antibiotic, particularly a narrow spectrum antibiotic used to treat the infection which are of narrow spectrum in nature. They are used to treat the serious bacterial infections in the body. They are used in the plants transgenic resistance and available in the form of injectable preparation in the market. Now, what is the particular mechanism of action of this particular drug, that is aminoglycoside type of antibiotic? Already while discussing the introductory part, we have discussed that aminoglycoside antibiotic is going to inhibit the protein synthesis if they are going to, while they are going to bind to the 30S ribosomal subunit. Now they are going to bind to the 30S ribosomal subunit. Now this 30S ribosomal subunit is interfering in the initiation of the complex. Now aminoglycoside 30S ribosomal complex induce misreading of genetic code possessed by mRNA. Now we all know the synthesis of protein synthesis steps. Protein synthesis steps particularly divided into two steps: transcription and translation. Now the transcription procedure is the message containing mRNA is transported from the nucleus to the cytoplasm containing a message which protein is to be synthesized. Now this message, that mRNA is carry forwarding from the nucleus to the cytoplasm. Now what happened if the person is treated with the aminoglycoside type of antibiotic? The aminoglycoside binds with the 30S ribosomal subunit, which will induce misreading of genetic code on the mRNA. Now this misreading of mRNA code, misreading mutation of the genetic code, and the synthesis of nonsense protein takes place. Due to misreading of the genetic code, the protein which is to be synthesized is not a proper or actual protein. They are going to synthesize something else, that is not having a proper amino acid sequence in its structure. That synthesized protein is known as nonsense protein. Now this nonsense protein are not of normal protein which is required by that bacterial cell for its growth. This nonsense protein cannot take part in the bacterial cellular activities. Now due to this misreading of mRNA sequence, they are going to synthesize a nonsense protein, and this nonsense protein don't have a structural or amino acid sequence similarity with the normal protein, but bacterial cell require normal protein for their further translational activities or for their mutations, for their replications, for their dividation procedures. But as due to the aminoglycoside, there is formation of the nonsense protein. This cannot take part in the bacterial cellular activities. This nonsense protein will disturb the permeability of the bacterial cell into the host cell. Due to the formation of the nonsense protein, the permeability of the bacterial cell is changed into the host cell, and due to this change in the permeability, Finally, the growth and development of the bacteria cell is disturbed. Due to this disturbance, the bacterial cell will die. Bacterial cell death occurs. Now, this is a mechanism, this is a pictorial diagram representing the mechanism of action of aminoglycoside type of antibiotic. Now, the way aminoglycoside antibiotic enters in the cell. Now, this aminoglycoside will going to go for the normal ribosomal inhibition. They are going to attach to the 30S ribosomal subunit of the bacterial cell. The moment they are attached to the ribosomal subunit of the bacterial cell, already we have discussed, there are mutational and modificational changes take place in the ribosomal subunit. Now, due to this mutation and modificational changes, there is change in the permeability of the cell. It's taken place. Due to this, the formation of the protein is a nonsense protein takes place, which is not required for that normal cell or the bacterial cell, which will inhibit the normal growth of that bacteria, and ultimately the cell will die. Now, what are the side effects and toxicity parameters, toxicity effects of the aminoglycoside type of antibiotic? No doubt, as having a macromolecular structure, the drug is going to have the nephrotoxic in nature. They will produce ototoxicity. Some side effects are headache, neuromuscular blockage, dizziness. The person is going to have dizziness all over the day, vertigo, fever, and sometimes the skin rashes will takes place while the person is going to take the aminoglycoside type of antibiotics. Next is our next class of antibiotic is tetracycline. Now, tetracycline. Now here the name itself gives an chemical idea about the drug containing 4 cyclic structures in its structure. Now they are basically octahydronaphthalene derivatives. No doubt they have the presence of 4 cyclic ring in its structure, but they are how these 4 cycles are formed togetherly. There is a attachment of the 2 naphthalene nucleus through side chain mechanisms, and they are attached together to form the octahydronaphthalene derivative, which is known as tetracycline, which is a bacteriostatic broad spectrum antibiotic. Now the terminology bacteriostatic belongs to, they will stop the growth of bacteria, and this particular antibiotic is basically broad spectrum antibiotic, will kill the bacteria, will stop the growth of bacteria of both, that is will stop the growth as well as will die that bacterial cell, as well as this is a broad spectrum means will going to show the action against gram positive as well as gram negative type of infections, type of microorganism. Now the word tetra belongs to 4 and cyclines belongs to cyclic compound. This particular type of class is introduced 50 years ago as a broad spectrum of antibiotic into the treatment. Now how they are synthesized? They are basically synthesized from acetic acid and propanoic acid subunit in the microorganism. Basically they are active against both gram positive as well as gram negative bacteria. That's why they are categorized under the class broad spectrum of the antibiotics. They are available for oral route as well as parenteral route. Now what is the structure activity relationship of the tetracycline? Now we are moving towards the structure activity relationship of the tetracycline. We have already seen the structure containing the presence of 4 cycles which are formed through a side to chain conjugation of the 2 naphthalene derivatives, and there is a formation of the tetracycline structure. Now, tetracycline containing less than or more than 4 rings are inactive. That means the statement itself gives an idea about they contain more than 4 rings in its structure. Now, this is a particular structure of the tetracycline nucleus which is used as an antibiotic. Now, we are moving towards the structure activity relationship of the tetracycline. So, these many points are covered for the SAR while we are going to discuss the structure activity relationship of this tetracycline nucleus. Now, conversion of the amide group which is at second position. If the amide group is converted into the carboxylic acid group or all other carbonyl type of derivatives, now we all know the carbonyl group can be converted, this amide group can be converted into the ester group, ether group, a carboxylic acid group. If we are moving or if we will change the second position amide functional group, it will totally decreases the activity. That means this amide functionality at second position is must for the activity. Now the keto-enol tautomerism between the carbon number 2 and carbon number 3 is very important in terms of the biological activity. Now we all know the presence of a double bond adjacent to the hydroxyl functional group will form the keto-enol type of tautomerism. Now the keto-enol change at carbon number 2 and carbon number 3 is very important for the biological activity. Now modification of the hydroxyl functional group at third position leads to no activity. That means this particular functional group at third position is must for in order to show the antibiotic action. Dehydration at 5A position leads to no activity. If the 5A position dehydration, if we are going to remove this functional group at 5A position, there will not be any activity shown by the particular class of the drug. Now epimerization at fourth position shows no activity. Now what is the meaning of the word epimer? Epimer means structural change in the structure only at particular point or particular functional group, particular carbon atom, only one carbon atom, and that is known as the word epimer. Now if a structure is undergoing any structural change at only one carbon atom, that is fourth carbon atom, that is the naming as a word epimerization at fourth position will not going to show any type of activity. Now next is substitution at fifth position. If we are going to substitute anything at this carbon atom, that is fifth carbon atom gives hydrophilic nature of the drug. If we are going to substitute anything at this fifth position which will gives the anything which is substituted at fifth position will increase the solubility of the drug in the water, that is will impart the hydrophilicity to the drug. Now dimethylamino group at fourth position. The presence of this dimethylamino group at fourth position will show good activity towards the as a broad spectrum antibiotic. Now presence of double bonded CH2 group at sixth position increases the antibacterial activity. Now presence of double bond at sixth position gives the antibacterial activity. Next, elimination of the OH group at sixth position increases the lipophilicity. If we are going to remove this polar group at sixth position, it will increase the lipophilicity of the drug, and the example of such class of drug is doxycycline. Electron donating or electron withdrawing group at seventh position. If we are going to substitute something at seventh position, whether it is electron donating group or whether it is electron withdrawing group at seventh position, increases antibacterial activity. Now very important one is the fourth ring, that is D ring, which should be always aromatic in nature. The D-ring always going to have the aromaticity property. Change in the D-ring, if we are going to change some things, substitution patterns or the structural changes at D-ring, it will lead to the biological inactivation. Addition of any amino group, a substitution at ninth position. If we are going to substitute anything to the ninth position, leads to new class of the antibiotic. If we are going to substitute anything at this ninth position, it will going to have the new class of antibiotic. Tetracycline rings are most important for the antibacterial activity as they are broad spectrum antibiotic. Now further classification of the tetracyclines. Tetracyclines are classified on the basis of their duration of action. Now they are classified basically as a long acting, intermediate acting and short acting tetracyclines depending upon their duration of action, whether they are active for more than 12 to 16 hours. They are classified or they are nominated, they are categorized under the class long acting tetracyclines. They are doxycycline, minocycline, miclocycline. Second class is intermediate acting tetracyclines having a duration of the time or duration of action in between the 8 to 12 hours. They are domiclocycline and methacycline. Next class is short acting tetracyclines having the duration of action in between the hours 6 to 8 hours. Examples of such classes of drug are tetracycline, chlorotetracycline and oxytetracycline. Tetracyclines are obtained from various species of streptomyces bacteria through fermentation technology. That means tetracycline basically derived through fermentation of streptomyces species of the bacteria. So this is a general structure of the tetracycline. The example and structural substitutions of R1, R2, R3 and 4 respectively is categorized under this chart. Tetracycline containing R1 at H hydrogen at R1 position, hydroxyl functional group at R2, CH3 at R third position, third carbon atom, and R4 is going to be substituted with hydrogen. So likewise the substitution chart is specified here in order to the all the drugs. Now what is the mechanism of action of this particular class of antibiotic? Tetracycline is going to inhibit protein synthesis. Now we have categorized or we have classified antibiotic on the basis of 4 classes. Those are antibiotics interfering in the formation of cell wall, antibiotics interfering in the procedure of formation of protein synthesis depending upon its spectrum of activity and whether they are going to change the any functional changes in the cell. So this class is coming under the class of antibiotic which is going to be interfering in the procedure of formation of the protein. Now tetracycline type of antibiotic inhibit protein synthesis by binding to the bacterial ribosome which is involved in the translation procedure. Now we all know protein synthesis involve transcription and translation procedure. The earlier drug, that is streptomycin, belongs to the class of aminoglycoside type of antibiotic, is interfering in the misreading of sequence of mRNA. That means it is interfering the procedure of transcription procedure, whereas the tetracycline type of antibiotics are involved in the translation procedure. That means they are particularly inhibiting the process of translation procedure process and shows the bacteriostatic activity. Bacteriostatic activity means inhibiting the growth of further growth of the bacteria. So for that they are going to bind to the 30S ribosomal subunit of the protein. Now they are particularly binding to the 50H subunit combined with the 30H subunit of mRNA and binds to the tRNA for the protein chain. Now, we all know that tRNA contain the binding sequence, that is codon and anticodons. Now, this tRNA containing codon in anticodon structure have the presence of P site and A site. P site belongs to peptidyl site, where actually the presence of amino sequence is there, and A site belongs to acceptor amino acetyl site. Now tetracycline reversibly bind to the 30S ribosomal subunit to the acceptor site to prevent the attachment of the aminoglycoside or tRNA, amino acid tRNA, and terminates the translation, that is a protein synthesis procedure. So this is a diagrammatic overview of how the tetracyclic antibiotics are going to show their antibiotic action. They are attached to the 30S ribosomal subunit and further going to show their antibacterial action. The uses of tetracycline, they are basically broad spectrum antibiotic used to treat various types of infections, to treat eye infections. They are low cost alternative antibiotics. Tetracyclines are used to treat cancer patients as well nowadays, to treat the respiratory infections like ear, intestine and sinus, to treat the gonorrhea. Tetracyclines are not used to treat the viral infections. Now, what are the side effects? Tetracycline is going to have various side effects like nausea, vomiting, diarrhea, teeth staining, teeth coloring like this, white patches on the skin will occur for some patients, vaginal itching and discharge, trouble in swallowing, that is dyspepsia, loss of appetite, and sometimes person may suffer from jaundice. Now, there are some precautionary measures we have to take while using the tetracycline. Complete the course of prescription. If a medical practitioner has prescribed a tetracycline drugs to any patient, the patient has to complete the course of the prescription. Pregnant women should avoid the use of tetracycline. Take on empty stomach with plenty of water. Basically, tetracycline should not taken with the milk, amino acids and the compound containing iron. Avoid exposure to the skin, avoid exposure to the sun. Tetracycline should not be given to the children which are of below 8 years old. Tetracycline passes through a breast milk, so they are avoid the use of tetracycline in case of the lactating mother. It will affect the bone and teeth of the babies. So this is overall about the everything about the two classes of the antibiotic, that is aminoglycoside as well as tetracycline type of antibiotic. Thank you all.